Associate Professor in the College of Public Health at the University of Arizona and is currently the President of the International Society of Exposure Sciences, or Exposure Science. Her research focuses on understanding how individuals are exposed to environmental contaminants and the health risks of these exposures, with a special focus on vulnerable populations. Dr. Beamer earned her BS from the University of California, Berkeley, and her MS and PhD from Stanford University. Dr. Beamer has considerably contributed to the current discussions regarding COVID-19 exposure. Welcome, Dr. Beamer.
Good morning. It's still morning here. Thank you for having me. I am an environmental engineer by training, so it's always nice to get to come back to my roots. And as the president of the International Society of Exposure Science, I often get asked, what is an exposure scientist? And no more than this year have I been asked that. And it's, we often get confused with our close colleagues in epidemiology. Epidemiologists study the association between exposure and disease. And exposure scientists, we feel like we study the relationship between the source of things in our environment and how they get to the person, how people are exposed. And that ties into aerosols, to water, to everything we do, all the media that have been discussed already today. But what we really focus on that I think is different is the people and their behaviors and how they interact with those media. And by studying that, we can think about how to prevent exposures or reduce exposures and control them by thinking about the ultimate person that we're trying to protect. One of the things that has come up a lot as we're working through the pandemic in our field is that everybody's trying to figure out how to do everyday activities in a new way to keep themselves and their families and their loved ones safe. So one of the things that I've been doing a lot is speaking to the public, speaking to colleagues about various different types of activities and helping them break down their work, how to do their work safely, but also how to do things like going to the grocery store safely. So what I was asked to talk about today was how to take the principles that I've taught in my classes for years and years and apply them to your everyday activities and how we can all use them to communicate with the public about how to stay safe during these times as we move forward and get used to our new normal. So really my goals in these talks that I've been doing, and I should have mentioned yesterday, I gave a talk here on campus because we are trying to come up with a way to allow students to have some more events because we know they need it for their mental health. And we're hoping that if we work with them to do the events safely, it'll prevent other events being done that perhaps aren't being done safely. So the goals in all of this is to give people agency on how to protect themselves, to have the knowledge to protect themselves and their loved ones. And the general steps I take when I talk to people about these sorts of things is first to break down the primary exposure concerns. And then we go into explaining what is called the hierarchy of controls, something that comes out of the field of occupational health. And finally, working with them and applying it to their scenario. I've worked with schools locally. I've worked with some of our local bike mechanic shops, even summer camps. So lots of different scenarios. So I think we are familiar already with what the primary exposure concerns are, and I think they've been highlighted along the way. And I guess I didn't include water here because that would be a whole different thing to consider. But right now, when we're thinking about how to protect ourselves, the first thing we want to think about is what is the source? And I think that's one of the things that makes this pandemic so hard is the source are infected people, many of whom are asymptomatic, especially like here on a college campus, that they don't know that they have been infected. And even symptomatic people are most contagious a few days before they develop the symptoms. That's one of the things that's so unique about this virus compared to previous SARS or to the flu, is that you're actually shedding the most virus before you even know that you're infected. And these infectious people are releasing virus, through close contact and close proximity, but it's also airborne, as we all keep, working on emphasizing in our field. And then once it's in the air, or even from surface contact, it could end up on fomites or other surfaces in your environment. And then we're all trying to protect that susceptible person there on the right. And so as it goes from the infected person to the susceptible person, it's traveling along these different, what we would call exposure pathways. So when we think about control, we want to think about the source, the path, and the person. So the hierarchy of controls is actually written into the OSHA code. People don't realize that it's been there for a very long time. It's used a lot in occupational health by both OSHA and NIOSH, and really it ranks controls from the most effective to the least effective. And they're ranked because the most effective controls, the ones that will help us stop the transmission of the virus earlier, are those that are at the source. And these include elimination. That's why we're all working from home. We're trying to reduce interactions. Substitution, we can't substitute coronavirus. We can't wave a magic wand, but we can substitute the way we do things virtually. Can we do something outdoors versus indoors? Engineering controls, this is where ventilation comes in and why it's so key and such an important step along the way. Same with barriers that we have, like the sneeze guards we have in the grocery stores. And then how we do things, changing the way we do things, physical distancing, washing our hands, all of those are what we would consider administrative controls. And then the least effective, not saying that they're not important, but they're the least effective is protecting at the source, at the infected person. So this would be wearing like an N95 respirator. If you can't control any of these things above you, you might consider wearing personal protective equipment, but that's the least effective. Face masks are not personal protective equipment. They're what we've been calling in our field community protective equipment. And that I would actually rank somewhere between the green and the yellow areas because it's stopping the source as close as possible to the source. By wearing face masks over our face, if we were potentially infected, we're stopping it really quickly. So I'll move through this really quickly. We applied this early on in the pandemic to flying, airplane travel. But if we were to walk through applying it to the airplane travel, I mean, you want to think through it really quickly. You would say, can you eliminate the trip? Can you substitute how you get there? Could you drive? Different airlines are doing things differently. Which seat is best? Window seats, actually, because you can minimize the number of people near you. Look at the engineering controls on different airlines. And then you can take controls yourself, right, by practicing good hand hygiene, bringing stuff along to wipe down surfaces, plastic bags to put your ID and stuff in. And worst case scenario, you could also consider wearing, a PPE, like an N95, obviously one with no valve, right, so that's not creating a chimney, and potentially a face shield. So this is how I would break down a regular common activity to somebody. So these are just a review of the steps I was mentioning, and you could apply these to any scenario. Next slide. And so I know tomorrow's Halloween, and we're all struggling with how to do things safely with our children. And so hopefully you consider some of these as you work through that with your family. And I will go ahead and end now. Thank you.